Okay, this chapter has to do with aging and the disease process. And the term senescence refers to the period of life from old age to death. And the chronological and the actual aging process can vary from person to person. And degenerative changes associated with aging may predispose an individual to certain pathologies, and pathologic changes can hasten aging. There are theories associated with aging. Aging is programmed genetically through the cells, and this control directly limits the cell's reproductive capacity. The term apoptosis, or programmed cell death, naturally occurs, and cells that accumulate waste products over time may undergo apoptosis. Aging is related to resident latent viruses or autoimmune reactions in which the body rejects its own tissues, or to environmental agents that affect cells. There's another interesting study that's been going on about telomeres, and telomeres, however you want to say it, shorten with each cell division makes cell division less reliable and increasing the risk of age-related disorders. And telomerase is the enzyme that maintains the telomeres, and this is an ongoing study that's being done to see whether somehow increasing the amount of telomerase, or somehow increasing the length of these caps on DNA can help increase lifespan. So studying telomeres, telomeres, would be an interesting, fascinating study. There's a lot of research going on currently. Changes in tissues. Here's things that happen normally: loss of elasticity, collagen loss, collagen cross linkages form that weakens the structure of tissue. Mitosis slows down as we age. Tissue repairs much slower. Neurons and muscle cells cannot replicate, so any loss diminishes function. And exposure to environmental factors, radiation, viral infection, chemicals over the years leads to an increased risk of cancer and other diseases in older people. Significant physiological changes with aging. There's hormonal changes. You have reduced number of target cells, receptors, and this happens with diabetes type 2. There's reduction of estrogen and progesterone in females during menopause, and this is caused by the ovaries' inability to respond to FSH and LH. Cancer of the reproductive organs is more common in both males and females in later years and is usually related to altered hormone levels. So frequent examination is really important. Cardiovascular changes that occur with aging. Accumulation of fat and collagen in heart muscle may interfere with the normal functioning of that organ. Decline in size and numbers of cardiac cells reduces the strength of cardiac contractions. And then you get stenosis of heart valves. The heart valves thicken and become less flexible, and stenosis refers to a hardening of tissues. So common pathologies that you see: arteriosclerosis, which is hardening of arteries; increased blood pressure; atherosclerosis, which is a buildup of plaque in arteries and blood vessels as a whole, really; myocardial infarctions, heart attacks, strokes, and peripheral vascular disease. Um, More changes, and this is involving the musculoskeletal system: osteoporosis, osteoarthritis, herniated intervertebral disc, muscle atrophy, which is normal in aging, and stiffness in joints and loss of coordination. So, focusing on osteoporosis, there's several risk factors. You can inherit the condition, decrease estrogen levels, because estrogen is part of the pathway in women to deposit calcium and increase bone mass and bone density. Sedentary lifestyle: if you don't use it, you lose it. So there is this fact that the more stress you place on bones, the denser they will become, and that has something to do with Wolff's Law that we studied in A&P. But if you lead a sedentary lifestyle, then bones tend to soften. Deficiency of calcium or problems with absorption will lead to a loss in bone mass and a decrease in osteoblastic activity. So how do you reduce the risk? Well, you can increase the intake of vitamin D and calcium. Hormone replacement therapy, but do your research there because that may cause a problem with some breast cancer, if the breast cancer problem is estrogen dependent. So do your research there. Walking and other weight-bearing exercise, and bone-sparing medications like Fosamax. And there are a lot of medications out there to help with increasing bone density. This is looking at a comparison of normal and osteoporotic bone, and on the left you see how thick that diaphysis is in that the phalanx there of the finger. And then if you look at the right side, how thin that actual bone is there, that compact bone, very, very thin and fragile. This is looking at a vertebral body and how collapsed the one on the right is. And remember, there are nerves exiting out in between these vertebrae, and that puts a lot of pressure on those nerves. There's a little space for those nerves in between, and so you have a lot of pain associated with osteoporosis as well. Respiratory changes, loss of compliance, and compliance means the ability of the lungs to expand and take in air. So that reduces. Atrophy of intercostal muscles can occur. Neurological changes, natural loss of brain cells. And remember, brain cells are not mitotic, so you lose them, they're gone, they're not coming back. Slowed reaction time, reduced reflexes, short-term memory lapses, and then special senses, glaucoma due to increased intraocular pressure, cataracts, which is a problem with the lens, where the lens is not as transparent, and lens replacements are pretty common now. Presbyopia, loss in near vision, hearing loss, and that's a normal change that occurs due to degenerative changes in the inner ear in the nerve cells of the cochlea, or could be the nerve cells supplying the ear. Sense of taste and smell diminishes with age as well. Digestive changes in nutrition. Xerostomia is dry mouth, and that's common because the amount of saliva produced is reduced. Obesity, common among sedentary seniors. Atrophy of the mucosa and digestive mucosa, and the glands that produce secretions that are involved with enzymatic reactions to digest nutrients. Absorption is reduced, so not only nutrients but vitamins and minerals absorb less readily as well. And constipation is common from decreased activity, low fiber, and fluid intake, and excessive use of laxatives, and can result in hemorrhoids. Urinary system changes. Decline of kidney function due to a loss of glomeruli, degeneration of kidney tubules, and blood vessels. Drugs are not metabolized effectively, so you have to be careful with the elderly. Dosages may be impacted, how much you could actually give somebody of certain things. Loss of control of bladder function as the muscles of the urethra and bladder become weaker. This reduces bladder capacity, and incomplete bladder emptying results in increased frequency of urination, nocturia, nighttime urination, and infection. Sometimes a weakened urethral sphincter results in incontinence. And then if you're still looking forward to older age, here are some more things to think about. So infections are common from poor circulation that impairs normal defense mechanisms, slow healing and tissue repair, frequent UTIs in males because of prostatic obstruction, and females because of bladder prolapse, incontinence, and thinner mucosa of the bladder. Increase in catheterizations from frequent hospital trips predispose the elderly to infection. Cancer is more common because of a less active immune system. Also, autoimmune diseases are encountered more frequently due to accumulated effects of exposure to environmental factors. And then drug reactions from having an increased number of medications. The more medications you're on, there's a higher incidence of having a reaction to one or more of those medications.